Hello, classmates. Today I want to share something important with you, something you may not have given much thought to. While most of us take our good health for granted, no one is immune to the ravages of old age and illness. Most of us go about our daily lives under the naive assumption that we are somehow immortal and will never get sick. But I want to let you in on something. Statistics from disabilitycanhappen.org show that more than 1 in 4 of today's 20-year-olds can expect to be out of work for at least a year due to an injury or temporary disability before reaching the full retirement age of 67. Stop for a moment and ask yourself, how could I possibly afford an extended hospital stay without any income for an entire year? If you were to be involved in a major, life-changing accident that required extensive surgery and rehabilitation, could your family afford to pay your hospital bills? Or even afford the rent? What if your parents needed an extended stay in a long-term nursing home? In today's world, most families would rely on some form of charity. That was the situation I found myself in recently. When last summer I was digging in the backyard, I injured my back, and unbeknownst to me, I had 2 herniated discs. I was unemployed and uninsured and in need of urgent medical care. After a couple of days, when the sciatic nerve pain was so severe that I couldn't take it anymore, I was faced with a dilemma: either go to the emergency room and pay out of pocket, or try to get better on my own. Luckily for me, living in Minnesota, I was pre-qualified for medical assistance through the MNsure market. I received excellent treatment and physical rehab. 6 weeks of physical therapy, acupuncture, and chiropractic got me back on my feet again. Thankfully, I was only financially responsible for a few small copays. All of my appointments and my prescription painkillers were covered by charitable medical assistance. I've since fully recovered, and I've returned to work, and I'm now enjoying life again, pain-free. But what about the 28 million Americans who don't have insurance, either through their employer or some form of charitable care like MNsure? In most states, if you were to lose your job, you would qualify for continued coverage under COBRA. You would then be responsible for the total amount of your insurance premium, something most people could never afford. In most states, if your combined family income is more than 500% above the federal poverty line, you would also not qualify for medical assistance. It's a difficult situation to find yourself in. Now, the dictionary defines charity as the voluntary act of help, giving help, typically in the form of money, to those in need. Our government acts charitably when it provides financial assistance to vulnerable populations. Many living in poverty qualify for food stamps and subsidized housing, but the U.S. is the only major developed country in the world that doesn't provide some form of universal health care to all its citizens. I believe that health care is a human right. I also believe that our system is failing us. State-sponsored grants and subsidies like those available through the Affordable Care Act are the only life support keeping our system alive. The symptoms of crushing medical debt, poor health outcomes, and worsening mortality rates make one thing abundantly clear to me: we must perform a radical overhaul of our healthcare system. Now, while many of you may be perfectly happy with your employer-sponsored insurance plan, you may be surprised by the out-of-pocket costs associated with many of these plans. One Harvard study determined that medical bills are the #1 cause of personal bankruptcy in the United States. To make matters worse, the majority of Americans, myself included, have little to no savings. most of us would be unable to pay an unexpected medical bill of only $400 without taking out a loan or selling something of value. So what about Social Security and disability benefits? While many low-income Americans receive Social Security and disability benefits, the AARP, the American Association of Retired Persons, projects that Social Security will run out of its cash reserves by 2034, a time when many of us will be reaching retirement age. And while Social Security provides supplemental income to the elderly and disabled, most retirees find out very quickly that Social Security alone is not enough to live on. When you add in the incredibly high costs of some prescription drugs, many Americans face an unthinkable dilemma, having to choose between life-saving prescription drugs or putting food on the table. According to the Harvard Gazette, while our country spends nearly twice as much per capita as other high-income countries, our health outcomes are far, far worse than those with some form of socialized medicine. The discrepancies in infant mortality rates among newborns are considerably worse for low-income minority populations. Having worked at a public safety net hospital for nearly 20 years, I can attest to the fact that those without health insurance are less likely to seek vital, preventative care such as prenatal checkups. Many people will wait for a health emergency before seeking medical treatment. Then, a trip to the emergency room is likely to be incredibly expensive, both for the uninsured and the hospital. But the situation is not totally hopeless. There is a very popular and cost-effective form of charitable health care that works for millions of Americans: Medicare. Expanding Medicare would simultaneously eliminate the most common form of personal bankruptcy and dispel the fear that many people have of seeking treatment. There is currently a bill awaiting approval in the Senate that would establish a Medicare for all national health insurance. If you feel as strongly as I do that access to affordable health care is a human right, then I urge you to call your elected officials in Washington, D.C. and ask them to vote yes on Senate Bill S1129. Former Vice President Hubert H. Humphrey from my fine state of Minnesota said, "The moral test of a government is how it treats those who are in the dawn of life, children, how it treats those who are in the twilight of life, the elderly, and how it treats those who are in the shadows of life, the sick, needy, and handicapped." It is unacceptable to me that in the richest country in the world, millions of Americans are facing staggering debt, even bankruptcy, from unpaid medical bills. And although we spend more per capita on health care, our health outcomes don't reflect this investment. I want to ask you one more thing. What other ways could our country be more charitable towards its citizens? Could state colleges and universities be free to all residents? How could we eliminate the crushing weight of student loan debt? I've been on both the giving and receiving end of charitable programs like the AFSCME free college benefit, and to me, it's made all the difference in the world. Thank you all for listening.